The problems that patients are affected by with difficulties in their pelvic floor are twofold. Firstly, there's the inability to hold on to the things that you don't want to empty, such as the urine and the stool, which produces urinary incontinence and fecal incontinence, as well as sometimes the inability to actually empty the bladder and the bowel at will when you need to. So patients feel that their bladder is incompletely emptied, they have difficulty starting the stream, they have difficulty emptying their bowels properly. It can mean frequent visits to the toilet 5-10 minutes apart on multiple occasions over some time during the day, which causes a significant amount of distress, along with the unpredictability of what might happen during the day when they're out and about. Women are affected by this far more than men. One doesn't really need a scientific analysis to look at the difference in the length of the queues for toilets in public arenas, cinemas, theatres, and anywhere out in public general where the men pop in and out as they wish to, and the women are queuing for 5 or 10 minutes simply because of the volume of people trying to access the toilets at any one time. The commonest cause that women would develop these problems is childbirth. Childbirth is a stressful, traumatic process for the female human body, and that would cause the majority of the symptoms that we see. However, it's accompanied by aging. We all get weaker and our tissues weaken as we age. That's why our faces wrinkle and our chins sag. And it's also added to later in life by the menopause with the reduction in hormone levels, which also maintains the integrity and the strength of the female organs. Globally, we would imagine about a third of women by the age of menopause or shortly after would be affected by some of these symptoms enough for them to have noticed them and for it to be bothersome. On a worldwide basis, we would estimate anywhere at the moment between about 600 million and 1 billion women worldwide would be symptomatic. As far as the severity is concerned, it can be quite a spectrum from a small amount of urine loss once a week, once a fortnight, which patients often don't find too bothersome, but they're obviously aware that it happens, to patients that have no control over their bladder or bowel at all. They wear large incontinence pads, which they have to change every day. It's socially embarrassing. They don't want to leave the house. And their life is affected to the point where they actually end up suffering severe depression and sometimes marriage breakups. The cost to society of these symptoms is enormous. There have been numerous analyses done in the scientific literature and by governments on the cost of this problem, and it runs into billions and billions of dollars. We're talking about the kind of money involved in patients having to pay for their own incontinence pads, for their medications to try and control the symptoms, lost work, lost productivity, lost taxation. It's to any single first world economy, we would be talking about tens and tens of billions of dollars every year. Surgery to date has been quite ineffective for these problems. For surgery to really be successful in any complaint that we treat, we have to have an understanding of the cause of the complaint and a working theory that explains the normal natural function. And that's something to date that we haven't had. So much of the surgery has been based on unproven theories that really, when tested to the necessary degree, seem to fail on each occasion. Much of this is due to the fact that we have separated the female pelvis into three different disciplines: urology for the bladder, gynecology for the vagina, and colorectal surgery for the bowel and fecal incontinence. And it's always been assumed that these three phenomena are separate entities that don't cross-relate with one another, and that each discipline should be looking after its own symptom with very little reference to the other symptoms. And in fact, it's more than likely that there is a central cause for all of this, and the disciplines need to be coming together to form a single discipline that looks at this as a whole.